Deputy Micheál Martin.
Thank you, Taoiseach. Thank you, Ceann Comhairle. Taoiseach, last week I highlighted the farcical situation in the Department of Health and in relation to the health services generally, where we had a situation with the health officials sitting on the board of the HSE, very tense meetings, not in a position to agree with each other. Health officials one day, HSE board members another day. And the budget overrun of a very serious nature, 250 million by the end of May, projected to run to 500 million by the end of the year. And all of that was a direct result of the Minister getting rid of the HSE board without putting anything in its place and creating a very significant vacuum at the heart of decision-making in our health services. And the results will be very serious for people on the front line and will be very serious for patients by the end of the year. Now, the HSE have argued, and the CEO of the HSE argued cogently to this House and to the Oireachtas committees that the Minister for Health did not fulfil his side of the estimate arrangements. And I've described that as a dishonest estimate, and I hold by that, because quite simply figures of 141 million were put in for revenue generation from private insurers and the drug pricing, another 100 million, and agency staff, all of which were not valid assumptions, and the legislation for private insurance not yet produced, and the session is up. It's a complete mess and a complete unacceptable situation. And this morning now we learn that the CEO of the HSE is to resign. And I would ask you, Taoiseach, I think he's a very highly regarded individual with considerable integrity, who has been placed in an impossible position by Minister Riley in relation to both the budget, the management and organisation of the HSE. Taoiseach, has he been shoved out by the Minister? And can you confirm why is the CEO of the HSE leaving this morning?
Thank you. Taoiseach.
Well, you've had a long tirade there. You've been asking questions about the production of the HSE governance bill for some time now. It was cleared yesterday by Cabinet and will be published today. And that bill will establish 7 directorates dealing with hospital care, primary care, mental health, social care, child and family services, public health and corporate shared services. And there will be a much clearer line of accountability in respect of the monies voted by the Oireachtas for provision of health services, with particular emphasis on the patient and the front line. We've made that point on very many occasions in the past, Deputy Martin, that the HSE in its structure and in the way that it was set up in the beginning created a lack of clarity about where the voted monies were actually being spent and how effective that spend was. And the May report produced by the HSE clearly shows overruns in some areas. Some of these are because of increased hospital activity and because of the throughput of patients through A&Es and so on like that. I understand that for some time that the Chief Executive of the HSE, Mr. Cathal Magee, has been discussing the intended changes to the structure of the HSE in the context of the governance bill with the Department of Health. And those discussions have been ongoing for some time. And having considered the new structure that is to be set in place, Mr. Magee has indicated that it's his intention to depart when the transition to the new structure takes place. Now, I would like to thank him for his service as a person of integrity and commitment. And the answer to your question is in the negative.
Taoiseach, whether you accept it or not, the current management of the health service is a shambles. The deficit at Limerick Regional Hospital, is 9 million. Galway deficit. Galway deficit at 7 million. Drogheda is at 6 million. Beaumont is at 8 million deficit. Tala at 7.5 million deficit. The Mater is at 5 million deficit. The CUH is at 5 million. And Vincent's is at 6 million. And I'm not saying this, Taoiseach. I'm not saying this. Everybody out there in the health service, is saying the situation is not sustainable, Taoiseach. We've already had the high-profile resignation of the CEO of the VHI because of disagreements with the minister. We have a volatile minister here, and senior personnel have left the health service because of his behaviour and the manner in which he deals with people. And the exit of the CEO of the HSE is being masked by a relabelling of positions labelled as some sort of fundamental redrawing of the architecture of health, which fools absolutely nobody. And Taoiseach, the bottom line is this: the government is running out of time. You prepared a false estimate in relation to health, and the minister did without question. And I would put it to you, Taoiseach, that you put the CEO of the HSE in an impossible position 12 months ago when he abolished the board of the HSE and when he had the Sec Gen as the chair of the board with the CEO of the HSE itself. And without question, he has been shoved out of that position in an unacceptable manner by the minister.
Well, it's actually utterly hypocritical of you to get up there and say that
Deputy McGrath, would you
and speak.
Thank you.
I find it completely hypocritical of you to stand up there and say that the chief executive of the HSE was being pushed by Minister Riley, and in the next sentence to say that the management of the HSE is in a shambles. That the management of the HSE is in a shambles. You can't have it both ways. As I say, I thank Mr. Magee for his integrity and for his commitment to his job. He's made his decision after discussions in respect of the new structure for the HSE, which, as I say, which I outlined for you, the 7 directorates will bring clarity and accountability for the spend of public monies, so that they're spent effectively in delivering care and attention for the patients who are at the centre of this. Now, you people, you set up the HSE.
Hold down, please.
You set up the HSE. You said to deliver world-class services, and that's the situation.
Thank you, Deputy.